Well, welcome everyone. My name is David Chieflos. I'm the chair of the World Burns Week Steering Committee, and it's my pleasure to welcome you to the global webinar series, this year's second edition of World Burns Week. We have a couple of instructions for you, particularly if you are tuning in from a region and if you're not a native speaker and would like to have some translation. So before we get started, I would like to share with you these instructions. So if you require translation, you are able to activate the auto-translated captions. At the very bottom, there is a box that should say subtitles or captions, depending on your language. You have to toggle that button there, and then you need to select English as the speaking language and your language as the caption language. So I'll give you a few seconds to get that set, and then Zoom should automatically translate the speaker's language into your desired language. Right. Okay. So, yeah, once again, thank you for tuning in to this webinar series. So it's one of those things that always moves me when it comes to burn injuries is that burns is disproportionately affects low and middle income settings. And in fact, the main determinants that determine whether you sustain a burn injury and how and whether you survive it and how well your outcomes are is where you live and how much money you earn, right? How rich you are. So this is why World Burns Week exists. It's to address these global disparities and hopefully highlight some of the ways that we can reduce the inequalities that there are, and hopefully as we start this week, this webinar series will give a platform to learn and hear from all these speakers and experts on some of the challenges that they've experienced, and I hope that we'll all be inspired by their success stories and ways that they are addressing burn injuries. Now, particularly this week is on. Oh, I went a little bit too far. Yeah. This week's webinar series and this year's World Burns Week is about prevention. And it's about prevention from the very beginning of the burn injury, but also preventing the complications and once the burn injury has occurred, as well as integration and isolation for burn survivors. So it's really throughout the entire continuum. As you can see here on the very left, we'll have a whole exciting program prepared for you with 5 different days in 2 different time zones, all about prevention of the different aspects of a burn injury. So that brings me to the moment where I'm really honored and excited to open World Burns Week 2025. And without much further ado, let's get started with day one. Michael, over to you.
Thank you, David. Good morning, everyone. My name is Michael Sergiu. I'm the Executive Director of the International Societies for Burn Injuries, and I want to welcome all of you to this exciting week. This is the second year we're doing this, as David said, and the first year was such a big success, and I look forward to all the webinars this week. So day one will be presented starting now and at UTC 13 to 1400, and it will be repeated again 12 hours later, UTC 1 to 2. I am the moderator for this session, along with my partner Shoban Conley from ANSPA, the Australian and New Zealand Burn Association. Our theme today is Safe by Design, Building Burn-Free Communities. The first webinar will focus on engaging and energizing the community, including governments, healthcare entities, lobbyists, and other stakeholders to push for prevention legislation and provide examples of successful prevention programs and campaigns from around the world. So today we're going to hear from a few speakers, beginning with Dr. Barkley Stewart, Mr. Alan McKern from Chile, and Dr. Kamal Fuyal from Nepal. Without any further ado, I want to introduce our first speaker, Dr. Barkley Stewart from the United States. Dr. Stewart is the Associate Chief of Trauma and Burns at Harborview Medical Center in Seattle, Washington. He's also the Director of the University of Washington Program for Rural and Global Surgery, and he currently serves as ISBI's liaison to WHO. Dr. Stewart, please go ahead and begin your presentation.
Thank you, Michael, and thanks again for the opportunity to be a part of World Burns Week, such a special occasion. I'm just going to share my screen and let me know if we're good to go. Looks okay? Great. So thanks again for the introduction. I'm Barkley Stewart, a burn and trauma surgeon from the University of Washington and a global injury prevention and control practitioner at heart. It's really an honor to participate in World Burns Week, and I'm excited to talk about how we can get on the same page with and work with one another for a future without preventable burn injuries. Though our humanity unites us around the world, the hazards we face from fire and burns are as varied as our kitchens, our homes, and our workplaces. Sorry, my slide was stuck. There we go. Additionally, there are regional differences in our cultures, our infrastructure, and conflict, which shape the patterns and causes of burn injuries around the world. And we continue to struggle against the burns born of cruelty, like child abuse and neglect, chemical assault and acid attacks, and violence against women and girls, and to meet the lifelong challenges faced by those who survive them, like stigma. And though we work and live within very different health systems, each with varying levels of organization and resources for burn care, we all share the same goals: to make safety, treatment, and rehabilitation a right for every person, not a privilege of place or income. Fortunately, even though our contexts differ, the risks of fire, burn injury, and the challenges of recovery are nearly universal and shaped by common factors such as poverty, crowding, and unsafe housing, social vulnerability and gender equity, lack of regulations and enforcement, and limited access to organized burn care. Despite this common ground, our efforts remain relatively fragmented. We work in silos and move in parallel rather than in concert often. We still don't know with confidence, for example, how many major burns occur each year around the world, or how many people die from them. Estimates differ orders of magnitude between modeling studies, gold standard epidemiological surveys, and national registries. And despite this uncertainty, only a handful of countries operate even basic burn surveillance systems, active or passive, capable of tracking trends, hazards, or outcomes. We do have a set of proven interventions with strong evidence, like smoke alarms, thermostatic mixing valves on hot water heaters, and safer cook stoves. But there are many hazards for which evidence-based solutions remain limited or entirely absent. Most critically, even the best interventions mean little if they are not sustainable, scalable, and evaluated rigorously when implemented. Without good implementation and follow-through, these ideas never become lasting impact. So like the blind men, each touching a different part of the elephant, we too are working within our own systems, hazards, and contexts, each holding a piece of the solution, all needing to come together to build a coherent global framework for burn prevention and control. But fortunately, in the prevention community, we've been here before. The UN Decade of Action for Road Safety was launched in 2011 in response to the alarming toll of road traffic injuries, then causing more than 1.3 million deaths and up to 50 million injuries annually worldwide, with more than 90% of those fatalities occurring in low and middle income countries. The goal was to mobilize global political commitment and coordinated multi-sectoral action to have road traffic deaths and injuries by 2020. This was later renewed through 2030 as a part of Sustainable Development Goal Target 3.6. One of the most powerful outcomes of the Decade of Action for Road Safety was the development of a truly global and intersectoral framework, a shared structure that brought order and accountability to a once fragmented injury prevention field. It organized the work of hundreds of partners around 5 pillars: strong leadership and governance, safe roads and vehicles, safer behavior among road users, and better post-crash care supported by robust, integrated, and shared data systems. This framework catalyzed real action, enabling countries to produce annual report cards that track progress and gaps in infrastructure, legislation, policy, and enforcement. These reports use standardized definitions of key policies and practices, allowing progress to be compared and monitored over time, with technical support from World Health Organization country offices and road safety advocates around the world. Through this shared framework, the world succeeded in bending the curve of road traffic deaths, reversing decades of steady increase. And even when the COVID-19 pandemic tested every system, many countries were able to continue this vital work given the shared mission. While tangible gains were made, much work remains. Many countries fell short on their annual report cards, and the overall 5% reduction in road traffic deaths was well below the ambitious 50% target set by the UN in 2010. And so we are now in the second decade of action for road safety and a renewed global commitment to finish what was started. When we talk about a framework, we're not just talking about bureaucracy. We're talking about a scaffold for coordinated and measurable progress. The decade of action for road safety showed what's possible. Shared goals and metrics helped more than 30 countries cut road deaths, preventing over 1 million fatalities. Burns need that same type of organizing logic, a global scaffold that adapts to every context, but aligns with common principles. Evidence-based and equity-driven means that using real data and focusing on those most at risk, like women cooking over open flames, children near scalding water, and families in unsafe homes. Partnership means no single sector owns this problem. Health, housing, energy, and education, all of us must work together. Accountability means shared indicators that track progress and not just promises. And above all, a framework must be responsive, flexible enough to address hazards from cookstove burns in Nepal to wildfires in California. In addition, it gives us a common language, so progress anywhere informs progress everywhere. So appreciating the power of a single global framework for road injury prevention, we must now ask, what pillars and actions will support a world with fewer preventable burn injuries? Think about it. A collective strategy for burn prevention isn't beyond our reach. It's simply waiting for our commitment to make it real. The International Society for Burn Injuries, or the ISBI, unites professionals from more than 80 countries and works with the World Health Organization to advance burn prevention, care, and research. ISBI is embarking on a global effort to create a comprehensive framework for burn prevention and control, and I'll share my email at the end with a QR code if you'd like to take part more fully. Even with a framework to guide our efforts, there's no magic solution to advancing burn prevention. It starts with us, with our network of partners, burn care providers, patients and survivors, community groups, fire services, and policymakers, identifying hazards we can change and supporting those most at risk. The most practical way to improve data is to use what we already have, linking hospital registries or leveraging existing syndromic surveillance system and emergency departments like those that already exist for things like febrile illnesses, diarrhea, or road traffic crashes. In places without robust data, we often depend on modeled estimates of burn injury. This figure comes from the Global Burden of Disease Study, the most comprehensive global data set available. It shows a sharp rise in burn incidents since 2015, which is almost certainly an artifact of missing or inconsistent data, not of true increase in injuries. To move forward, we must strengthen injury surveillance, connect systems of data that already are in use, and use reliable data to design, evaluate, and sustain effective prevention programs. The good news is we don't need to reinvent the wheel. There are already lots of successful interventions we can adapt to the settings where our patients live and work. But we also know that what works in one community may not work in another. Context really matters in burns, which is why implementation outcomes like feasibility, acceptability, sustainability, and cost must be valued equally as effectiveness. And when we share results, we need to share both the impact and the process that each of us undertake so that others can build on what works. You can scan the QR code to access our implementation science guide from the University of Washington, which provides a quick, practical way to strengthen your approach to burn prevention. Around the world, powerful prevention programs show that anyone, from community advocates and burn centers to non-governmental organizations and policymakers, can drive progress in fire safety and burn prevention. In the United States, a growing movement once paralleled major smoke alarm campaigns, pushing to require home fire sprinklers in new construction, particularly multifamily dwellings. This evidence was clear. Sprinklers save property, reduce injuries, and prevent deaths. Yet around 2010, more than a dozen states passed laws to limit, yes, limit these interventions. Thanks to the persistence of advocates like Amy Acton and the Phoenix Society, fire marshals, and the National Fire Protection Association, that tide turned. Today, California, Maryland, Massachusetts, and New York have statewide sprinkler mandates, and many cities and countries have followed suit. Most importantly, this local grassroots effort drove change in the International Code Council's residential fire code, proving that coordinated advocacy can shape national and even global standards. Dr. Bhupendra Sarma in Guwahati, India, showed us the true power of prevention led from a burn center. He and his team launched a multi-pronged program combining school-based education, community health program, and pre-Diwali social media campaigns, meeting people when and where risk is the highest. But they didn't stop there. They rigorously evaluated their work using an interrupted time series design with control communities across Assam state. The results were staggering, a 45% reduction in burn-related hospitalizations in Guwahati, while neighboring areas saw a 41% increase over the same period. This is what success looks like: locally driven, evidence-based, and scalable. Dr. Sama's model shows that when burn centers lead prevention, the impact can ripple far beyond hospital walls. Quanakim is an extraordinary nonprofit in Chile dedicated to child burn prevention, care, and research. For decades, they have used their burn registry as a form of syndromic surveillance for firework injuries and other injuries, documenting a recurring pattern of preventable harm during national celebrations. In response, they launched creative public safety campaigns with marketing experts, building broad community support. That momentum led to a collaboration with legal partners to develop a legislative toolkit, ultimately resulting in a national ban on retail fireworks. Since then, they have supported other Latin American countries, trying to follow their lead with pilot programs to restrict retail fireworks sales and use, proving that data, advocacy, and persistence can translate directly into life-saving policy. We have the privilege of hearing more from Quanakim shortly. Our group at the University of Washington partnered with Acid Survivors Trust International, and human rights legal experts to conduct a global policy analysis of 104 countries. We examined the laws and regulations related to chemical assault and acid violence, including chemical sales and chemical restrictions, legal protections for survivors, safe litigation strategies, and models for rehabilitation and integration. This collaboration brought together the voices of those most affected with the expertise needed to inform real policy change, showing how science, law, and lived experience can align to prevent a particularly devastating form of burn injury. To maximize our impact, we have to think beyond the burn community. We must build a broad coalition connecting health, housing, energy, gender equity, disaster risk sectors, and others, and graft burn prevention into movements already with or gaining momentum, from climate resilience to safe cities and maternal and child health. And just as importantly, we must advocate for domestic investment. Sustainable prevention can't rely on grants and goodwill alone. It must be embedded in national budgets, policies, and priorities. World Burns Week is a great chance for us to build a coalition of the willing, bringing together community groups, non-governmental organizations, and government agencies to amplify prevention efforts. Collaboration doesn't have to start from scratch. Joining existing data initiatives and prevention programs is an easy way to get started. The lessons from these partnerships can then be used to create scalable models that work in diverse settings, turning shared learning into shared impact. We can go farther and faster by linking burn prevention to existing global health movements, just as HIV and maternal and child health programs succeeded through alignment and not through isolation. We can graft our goals onto well-funded and visible agendas, like advancing safer cook stoves through social justice, indoor air pollution, and climate change movements, integrating smoke alarms and fire suppression systems into urban and slum health initiatives, and embedding chemical assault prevention within broader efforts to address gender-based violence. When we align with momentum that already exists, burn prevention can become part of something bigger and much more powerful. Wealth is rising in nearly every country. Even as there is incredible inequities within and across countries, the growing capacity gives governments new opportunities and responsibilities to invest in injury prevention and control. We can and should make the case that burn injury prevention is not just a moral imperative, but an economic necessity. These injuries cause measurable losses to the gross domestic product through lost productivity, indirect care costs, and property damage. Investing in prevention strengthens the social contract and delivers a clear return on investment. Examples abound. El Salvador increased tax revenue from 4% of gross domestic product between 2005 and 2013 and used it to cut child mortality by 75%. In Rwanda, rebuilding after genocide, they grew revenue from 3.6 to 13.4% of gross domestic product and reinvested in essential health services, including reducing mortality across multiple conditions, including road injuries. These are powerful examples and reminders that when countries raise and reorient domestic resources toward prevention and health, mortality falls, systems strengthen, and progress toward the Sustainable Development Goals accelerates. The same can be true for burn injury prevention and control. Across the world, our hazards may differ, from open flames and electrical burns to acid violence and industrial fires, but our goals are the same: to prevent suffering, protect lives, and to ensure recovery with dignity. A global framework for fire and burn injury prevention can unite us around shared principles while allowing each region to tailor its actions to its own risks and resources. I've included a QR code here to my email if you'd like to get involved in the ISBI Framework Initiative. Submit your initial thoughts on the key pillars and action priorities in the email, and expect to follow up real soon on how to participate more fully in the process. And we don't have to do it alone. By leveraging existing global health movements, from climate resilience to urban safety, gender equity, and health system strengthening, we can multiply our impact. Together, we can turn shared purpose into coordinated action and make burn injury prevention a defining public health success of our time. Thank you.
Thank you, Dr. Stewart, for this dynamic presentation. Thank you so much. Before we move on, I want to let all of our attendees know that you're welcome to place any questions you would like to bring forth into the Q&A section. Now, I would like to introduce, as we move on, Mr. Alan McKern Hopkins, who is the Head of International Affairs at Coanigem, Chile. Alan, please go ahead, sir.
Thank you very much. I'm going to share my screen. Right, can you confirm that you're seeing?
Yes, please go ahead. Yes, everything is in order.
Excellent. So here we go. Right. Well, hello, everybody. I want to thank you personally, Michael, for the invitation. And I want to thank the whole organization of the World Burns Week. It's really an honor to be a part of something with, such an international and a broad reach. Today, I'm going to be talking a little bit of what we've done here in Chile and what we've learned along the way. As you said, I'm Alan McKern, and I work with Coanigem. Coanigem is a nonprofit in Chile, and we've been working for 46 years in pediatric burn rehabilitation, prevention, education, and research. So I'm happy to also share this panel with Barclay Stewart. That was a very nice coincidence, and he brought up one of our case studies in a way about fireworks. And so today I'm going to talk a little bit about, I'm going to actually talk quite a bit about our fireworks case. It's our main prevention case. And it's also our best documented case that reached the international arena, so to speak. And then I'm going to show another few examples of where design can also make a difference, and just close the whole talk with a few closing remarks. So straight to it. In Chile, it's very unusual today to celebrate with fireworks, to be around fireworks, or when you have a New Year festivity or Christmas festivity, it's not that normal to have children or grown-ups celebrating with fireworks around firecrackers and so on. However, this was not always the case. Back in the 80s and the 90s, fireworks were absolutely everywhere. They were used at home, they were used in the streets, they were used by kids. And, Southern Hemisphere is mostly concentrated around Christmas and New Year. And what happened is that we started seeing lots of children coming to Quaniquen Burn Center facilities, to receive, to be treated. They came with lots of serious injuries, burns to the face, hands, eyes, the typical injuries that you get when people play with pyrotechnics or use pyrotechnics. At that point, there was no real control. Fireworks were sold informally. You could just go around the corner, buy fireworks or firecrackers, and people didn't see that as something that was dangerous, and they didn't really relate to fireworks as they relate to explosives, which is actually what they are. So after, in the 80s, in the 90s, we started, really looking into this problem specifically. We started collecting data with epidemiological surveillance that still runs through every year, the 6th of December to the 6th of January, just to understand what was happening. And at the same time, also back in 1993, we started with our first awareness campaign. See, curiously, this data that we collected and this awareness campaigns actually became the basis for convincing the authorities that the problem was bigger than everybody thought or everybody anticipated. So slowly but steadily, we started to change the idea that fireworks, firecrackers are actually explosive, they are dangerous, and it's absolutely very risky. We realized, though, that information alone is not enough. We need to get to a broader audience. We need to raise our credibility. So we partnered, and this is also, I think, a very nice example of what Barclay was talking to us about a while ago. So we partnered, if you want your message to be really convincing and compelling, we partnered with advertising companies. You want your message to be absolutely everywhere, you partner with media agencies. So we had a compelling message. We had it absolutely everywhere, television, radio, newspapers, you name it. And the other thing that I think was extremely successful was to partner up with the law enforcement and the Ministry of Health. Because by doing that, they validated our message, our prevention message, and actually endorsed it. So it was really, really big. This started again in the 90s, but we do this till this day. And till this day, we have joint press releases with the Ministry of Health and law enforcement. Obviously, times have changed. We're not in the 90s anymore. And we have moved online. So now we have, Facebook is kind of for a certain age group, but Facebook, Instagram, even TikTok, our prevention message has moved with the audience. And what happened? No, and this is a little bit very nice slide, something that we're very proud of here in Chile, that shows what happened after the year 2000. And the year 2000 came after 6 years of public advocacy. This happened after 6 years of being, working with the authorities towards legislating to ban consumer fireworks. And it actually happened in the year 2000. So we banned fireworks for the sale, the purchase, and use of public fireworks, consumer fireworks, that is. So if you see fireworks in Chile, they are only going to be from licensed professional shows that obviously have their permits in order. And what we saw, and what you can see here on the screen, is that the effect of banning consumer fireworks was immediate. And so the results of our epidemiological surveillance, this 1 month period of time that we monitor how many children under the age of 15 are being injured by fireworks, dropped dramatically. So it was about a 90% decrease in the record of burn injuries for children. And ever since this law was passed in the year 2000, our numbers have always remained rather low. I mean, we've got spikes every other year, but in average, the impact is consistent and it's been low. The other important thing to add is that ever since the law has been passed, there has not been a registered death because of fireworks. So no one else has died because of use of fireworks. The other thing that we learned, and this is also quite interesting, is that, you know, we're in 2025, we've already got 25 years of a good, you know, legislative practice, let's say. We've been banning fireworks for 25 years. So what happens with our awareness campaigns? And this is something that is also interesting. We tracked the numbers, and every year we realize that even though we have awareness campaigns, even though fireworks are banned, we don't see a decrease, a further decrease, something that is statistically significant, that actually reduces even more the number of injuries by fireworks. So this is kind of telling us, okay, you definitely need an awareness campaign. That's essential. You have to be top of mind, but that alone is not going to reduce the number of injuries any further. So the big difference, at least in our case, came from having and from enforcing the law. So the takeaway for us was pretty simple. You have a law in place that matters, but you have to enforce it, and that matters just as much. Without enforcement, it's no use. Awareness, people forget, so you need to be reminding people of the message, of the risk, of the danger. So communication, we know we have to keep this top of mind. And data, you need to have something that closes this circle with data. We need to be able to show, okay, what else is happening? We need to monitor the situation, see? Finally, for this little bit is, this can't be possible if there isn't cooperation. That's what I liked about what Barclay was saying earlier as well. This framework has to have cooperation inbuilt in it. And this is where we maybe intuitively discovered what we are now calling, or I am calling, the virtuous circle of public and private relationships. And in essence, kind of describes of how we went about this problem back in the day, and what we've done and what we keep doing to this day when we address issues like fireworks. It basically, how it tends to work now. So we usually detect a problem, we treat the patients, and we start seeing trends. We see the trends before the rest of the society. And so we share the data, we research the data first, we share that, and then we push and push and push for change. And the government steps in, they're going to draft a norm, a regulation, even a law in the case of fireworks. And because these laws, regulations are in place, they are also going to support the surveillance because they need to know if it's working, if what they're doing is working. So they also support the surveillance. So that works really nice for us because we already are running an epidemiological surveillance. So society, in the end, benefits from all of this, from a safer environment. And after an extended period of time, when the results show a real impact, you start to change a culture. And that is amazing. And I say it as a foreigner living in Chile. I've, now been eight years living here. And it was really, really surprising the first New Year's I spent here to see that it was absolutely incredible not to see anybody celebrating with fireworks and firecrackers and so on. So that is something that is true. I mean, you can actually change a culture. Everybody was, same festive and celebratory season as always, but just no fireworks, no danger, no risk, and it happened. So how do we close this circle? Obviously, eventually, new patterns are going to appear. The cycle starts again, and Kwanikem, we are going to be there, just waiting for the next thing to arise, detect trends, and feed that to the government as well. So that's how a little virtuous circle works. After years, in 2018, after years of good practice, we decided at Kwanikem, maybe we should do this abroad. I mean, if we had so great results in Chile, why can't this work outside of Chile? And the first thing you do, obviously, is do some research. And the easiest place to do research is looking through data. There's not much data available, but the United States gladly has a lot of information publicly available. And we learned a lot of things about just studying how the phenomenon of fireworks specifically in the United States was treated for over a century. So we found out that fireworks has always been linked to mutilations, to death. We found out that the problem is widespread. It's not something that happens in Chile. It's not something that happens in Latin American countries. It's not something that happens in the US. It happens everywhere. And it's not only everywhere, it's always. And that was also kind of a interesting piece of news. The first data recorded in the United States is from 1899. So this is something that, you know, we needed to know. This problem is bigger than we think and bigger than we let ourselves think. There have been total bans, safer substitutes. The discussion around fireworks always goes through the same things. And the other important takeaway here is that there's a very strong economic and cultural lobby, and those are always present and they slow down progress. So that's something that we have to be aware of. So we said, okay, we're going to apply the same virtuous circle to the international arena, let's say. So we partnered up with the Foreign Affairs Office of Chile. We went to the Chilean mission to the Organization of American States, and we brought this issue of fireworks to a regional forum. And in the process, you can see a long set of steps there. We learned a lot. So we learned that fireworks were a cross-cutting topic. We learned that, you know, you have to partner with lots of different stakeholders. And well, that insight is what helped us finally get this to be, you know, paid attention by the committee, the Inter-American Juridical Committee, that after a period of 3 years, came around with a series of recommendations for the domestic legislation of fireworks. So any member state of the of the Organization of American States now has a document that recommends how to approach the legislation of fireworks on a local basis. So that's the result of this international advocacy, let's say. So these are the things, other things that we learned. So, you know, again, work with multi-stakeholders. You have to adapt the language that we use to the framework that we're using at the time. A little bit of what Barclay was saying also. You know, if you're SDGs, if you're the Sendai framework, depending on what topic you're working, you have to adjust your language to that. Another thing that I find extremely interesting is that because we work with multiple stakeholders, you also realize that some of the messages they send, some awareness campaigns, they're all about fireworks, but some focus on animal welfare, some focus on veterans, some focus on health, like us, but not all carry the same weight. So sometimes communication is much more effective, for example, when you focus it on animal welfare. So learning those little tips really helps when you want to push the whole cause forward. And now I'm going to talk a little bit of other examples of prevention by design in Chile. Here we've got on the left a child pulling from a cord of an electrical kettle, and a child, you know, climbing on top of the door of the oven and tipping over what's on top of the kitchen stove. These were actual problems that also came, we realized at Gonikem, a little bit following the cycle of before, but that happily were solved. So in great measure. So basically what would happen is that they would pull from this cord. So we started meeting up with in a multi-sectoral table of people, multi-sectoral work, and figure out, okay, what is the problem? How do we prevent it? What can we do? And in the long term, what happened, it was something super simple. We just need to shorten the length of the cord. And by doing that, children don't reach the cord, can't pull from it. They don't get scalded by the content of the kettles. So that was a low-cost design fix that, you know, prevented hundreds and hundreds of burn incidents. The other one is related to kitchen stoves. So again, Gonikem worked with the manufacturers of the stoves and many other sectors of public and private society. And the solution also, again, might not strike like something that you would find at NASA or something very sophisticated. In the end, what they decided is to put a counterweight on the back of the oven so it wouldn't turn over, even if someone, you know, climbed on the door of the oven. They also applied this latch that you can see here, the red latch, so they wouldn't be able to open the door easily, children, and a double-walled glass on the oven door so they wouldn't get contact burns. And so this is a good reminder that design changes are very, very effective, and they can be as effective as awareness campaigns. What we're working on now is a multi-sector effort. It's also led by Connie Kim, actually Orlando Flores, who is, well, for many of you who might know him, is a big a person that is very influential in the work of smoke detectors here in Chile. And it's another step in Chile's ongoing journey toward prevention by design. Now, here we have a lot of actors represented, and this is now at the Legislative House of Chile still being discussed, but we hope that we're going to have a good outcome. So just to finish, we have seen that prevention really works when design and when regulation come together. Awareness and communication, we just have to do that, but we really need, if you want to make change that lasts and that is clear, we need clear laws and we need continued enforcement. Public and private cooperation, you need that absolutely. This is behind all of these things that we've mentioned, and it's there when we talk about fireworks, stoves, boilers, smoke alarms, whatever it is, it's this collaboration between all of these actors that makes it work. And because new risks always appear, we go back to the start of the circle, we collect the data, we act, communicate, we measure again. And that has been what's worked for us all of these years, and I hope this information is useful for anybody that wants to work towards prevention. Thank you very much.
Thank you, Mr. McKern. Excellent presentation. Great work done in Cuaniguén down in Chile. Thank you, sir, very much. We're going to move on now to any questions and answers, any questions by the audience that the two speakers can address. I'm opening the Q&A section, but I don't see anything that comes up. So I guess the audience don't have any questions, but I was wondering, Davey or Natalie, is there something that was placed maybe in the chat section?
Michael, there is one from Mumta, just to Alan. She said, fantastic initiative that's worked. Are you able to comment on the residual injuries that you're still seeing year on year?
Thank you.
I'm guessing she's referring to fireworks. Yes, we still keep to monitor the cases. We have about, I think the last year was nine children under the age of 15 that came in with fireworks injuries. I should notice that, or mention that we are a burn rehabilitation center that works with children. So obviously the population that we address is mostly children. However, because we've had we've been such a protagonist of this issue in Chile, we kind of know, I mean, if there are other, cases related to grown-ups that come up, and fortunately they're not, there's not that big an amount of cases. So the residual, could you translate the question again for me? Is it how many are still burned, or? Give me a sec.
Sorry, it was just saying, can you comment on the residual injuries that you're still seeing? So, yeah.
All right. So, yeah, we see those about 9 the last year. They are still pretty bad as any injury by fireworks. So there are, and there is someone, Orlando is commenting, there are nine children under the age of 15. The other thing that is interesting to mention about these residual, the 9 children that are injured, is that they're not always handling the fireworks, and that is something that is not always known. Sometimes it's just, fireworks shot out through the neighbor's house or whatever, and they're still getting injured. So I think that's kind of the interesting idea of having a whole framework that helps to prevent these things, which don't even have to be a part in the celebration of fireworks.
Thank you. And you've got another
you.
one from Ronan, who said, what about the collaboration of industry? Reducing the length of electric cords is good because the production gets cheaper, but anything else?
Yeah, I think we agree. At the end of the day, if it's cheaper for the producer, they're going to be absolutely on board. However, in the case of the stoves, I'm not sure it was cheaper. But in that case, we are also working with the government, and it's part of the regulation and certification. So at the end of the day, yes, this is sometimes not an easy discussion. As I mentioned also before, there are lots of interests here. Lobby is economical, it could also be cultural. There's lots of things going on. So yes, I think we agree. It's going to be challenging, but it is the way to go.
There is another question from Shannon Hudson. Have any prevention campaigns been done on hot water burns from cooking food over fires? Either one of you, please, if you can address it.
Yeah, I'd be happy to take this. I mean, that what we learned from the relatively short but very effective participation of many hospitals in the World Health Organization Global Burn Registry is that, as you allude to, cooking-related both fires and scald burns in children are amongst the most common causes of burn injury in the world, probably the majority of burn injuries. There's been lots of different campaigns, again, nothing in coordinated global strategy. UNICEF had the Safe Cooking Initiative, which was really focused in Africa and South Asia, that worked to create child safe or safe child zones around cooking areas, the 3 feet no heat concept, and then use of wider-based pots to prevent tipping. There were some small-scale trials, I think, in Uganda and Nepal that demonstrated efficacy for that. One of the best approaches for this has been the community Creech model, which was a randomized trial, cluster randomized trial, I believe, of shared supervision of children in small areas of villages or areas of towns, where during cooking time, one or more people in that community would watch the children so that all members could cook, even if there weren't very safe cooking arrangements. It allowed for children to be separated from them, and they showed a decrease in pediatric burn injury. Additionally, the Global Alliance for Clean Cook Stoves, or Clean Cooking Alliance, has done a lot of work thinking about how to transition unsafe cook stoves that are predominantly three-stone fires or not improved, non-thermodynamically improved cook stoves. They worked with engineers to create stable platforms that the improved cook stoves could be put into, enclosed combustion chambers to prevent flames from being extruded from them, and pot skirt designs, again, mostly to reduce accidental tipping of boiling liquids. What's, I think, important from all of these things is that there's been a ton of work on improving cook stoves from an indoor air pollution perspective, but those trials, including very large national trials of rolling out improved cook stoves, haven't included safety metrics because we haven't teamed and built a coalition with folks focusing on improved cook stoves. Lastly, that there have been efforts to transition cook stoves from improved cook stoves, which are still a biomass-based fuel source, to LPG stoves, and that's happening very rapidly across the world. And safety standards for LPG stoves are extremely variable and don't necessarily have things like automatic shutoff valves and regulators, clear on and off switches, adequate standards for tubing. They don't have tippability measures that prevents them from tipping like the ovens in Chile. And recent work in Nepal showed that about 15 to 20% of all cook stoves or all LPG stoves have active gas leaks when you do a soap and water test. And that's a good opportunity to build regulations into refilling stations to do safety checks. So lots of work to be done, and particularly if we build coalitions and work with those focusing on cook stoves more broadly.
Thank you, Dr. Stewart. Next question comes from Aram Abdul Razak. And the question is, do you have any suggestion for BERS guideline to management and prevention of burns in children? It's kind of a broad question. Either of you would like to address this one? I'm not sure exactly how to go about answering this one, but
We do have a session tomorrow on day 2 for preventing burns in children. So if you join tomorrow, Aram, that might actually be answered for you then.
excellent. Thank you, Shobha. Let's see. Go ahead.
I see that question from Mamta about moving forward with the framework. The ISBI is helping to support a modified Delphi approach to getting global consensus on what a framework pillars and action priorities need to be. It's being led by Dr. Anusha Jayaram, who I see is in attendance. So if you email me, we'll get certainly started. We anticipate a snowball sampling. So the network of the World Burns Week participants and the International Society for Burn Injuries members will certainly be enough to ensure that we have very broad intersectoral global input on what this should be. And hopefully we can bring this back to the burn community for more input publicly once we get a good draft together. So email me and we'll get started, get you in the process to put your opinions and ideas in.
Thank you, sir. Chopin, do you have anything else in the chat? I do have some more here. I don't know, maybe 2 more questions we can address. Anything from you, Chopin, in the chat? Okay. So the next question comes from Joe Myers. Concern here in the UK about significant rise in hot water bottle scalds in children over the last few years. Has this been seen in any other countries, and is there any action taking place elsewhere?
Well, I can tell you what happened here in Chile, and there was a big rise in injuries by scalds, really, by hot water bottles. And in our case, particularly, it was because they were defective water bottles. So we had lots of imports with water bottles that were defective, and we saw a rise in scalds that was hugely incredible. So in that case, what was effective for us was, again, to go to authorities and let them know, hey, this is happening. We didn't know that they weren't regulated. So we helped them again, okay, look into that problem. They studied it and realized, okay, no, we need some regulation around water bottles. But yes, other than that, we're working on prevention campaigns specifically for that. Here we call them guateros, but it's a hot water bottle. Yes.
Thank you. Can we address that? I think that's all. There is one from very nice presentations. Thank you. This comes from Zahid. I'm working for an NGO. We started an awareness campaign for burn prevention today. My question is for both speakers. How do they start their collaborations with policymakers and industry for burn prevention measures? What is the starting point to impact them as an NGO? Great question.
Maybe I'll start with a few things, and Alan, with your NGO experience, maybe tack on. I think a few things. One, data and having data and telling a story. And I think Quantic Kim's work with fireworks, again, when I first heard that some years ago, it just blew my mind. It was the perfect combination of collecting high quality data and telling a story, and looking for what we call policy windows, or the concept that there's popular need, an opportunity, or a mandate that puts political pressure on policymakers, and known evidence or strategies to implement to make change. So by doing research, having evaluation programs organized and published helps to provide evidence for when those policy windows open, that you can help attach yourself to policymakers and make change. I think Alan also mentioned a little bit about the concept of don't let a good crisis go to waste. There's been lots of examples of these things of injury prevention. I mean, we could talk about them for a very long time. When you notice that something happens, a tragedy happens, the public is outraged about something, if it aligns with the burn injury agenda, use that as an opportunity to demonstrate the data we have, the programs that are effective and can be implemented to address these problems, which again make policymakers be shown in a good light, and so they're all certainly looking for that.
Thank you. I think this concludes our Q&A section of the webinar. David, back to you. Actually, I will address this, the slide you see here. If our delegates are seeking a certificate of attendance, please fill out the survey via the QR code you see here, and you will receive a certificate. Also, if you want to learn more about the rest of the week and the webinars that take place every day, please go ahead and use this QR code. Tomorrow, the theme of the webinar is preventing burns in children. Day 3, preventing post-burn complications. Day 4, preventing the chaos. I'm sorry, I am blocked here by comments. The chaos of mass casualty disasters. And day 5, preventing isolation through community and connection. Also, if you want to learn a little more about what's going on this week around the world from our partners, please click on the QR code to the right to find more about local activities and initiatives during this World Burns Week. Thank you. I believe this concludes the webinar for the first day. Please save the day for World Burns Week 2026. The festivities will take place from the 2nd to the 8th of November 2026. Thank you all for joining our webinar today, and we look forward to seeing you during the festivities here and the webinars the rest of the week. Thank you all. Bye-bye.
Can we, Natalie, can we just go back to the survey for post? People are asking, can we just put that screen up for people? Thank you so much. Oh, that one. Perfect. Thanks. Thanks, Michael.
Thank you. I guess we can leave that on there for a few seconds. Thank you all again, and enjoy the rest of your day or evening. And I hope we see you all tomorrow. Bye now.